Hi, I'm Luke Bongiorno, Director of Physical Therapy at NY SportsMed, with some advice on the best, most effective ways to treat a hamstring strain. The hamstrings are a group of muscles very important to aid in the stability and the flexibility of the hip and the knee. The most common sports-related injury of the thigh is a hamstring strain. Usually occurs while sprinting. Sudden stops or starts of motion or too much twisting can overexert the natural elasticity of the tendons, which can be a leading cause of the problem. Symptoms include pain and swelling at the back of the knee, and additionally you may get some bruising, which can occur within about 1 to 2 days after the incident. It's important to remember the word RICE. That's rest, ice, compression, and elevation. If pain in the area is causing you to limp, you should use crutches for additional support. Physical therapy massages are often prescribed in conjunction with mobility exercises and stability exercises. A return to full function requires a targeted, often sport-specific conditioning of the tendon group, as well as a proper warm-up education, core and stabilizing and postural exercises. A regimen might include lunges, eccentric exercises which strengthen the muscle as it's lengthening, and dynamic stretching are also advised as they help strengthen and balance the core and the glutes and help you to avoid re-injury.